Louisiana's hospitals were already filled with COVID cases ahead of Ida. Now they're dealing with those that were injured in the storm. Imagine this, a patient in Louisiana being medevaced all the way to Utah. Earlier, I talked about it with our chief medical editor, Dr. Corey Hebert, about the fears that we could be looking at one giant super spreader event.
Right now, there is no power in New Orleans, right? We think that there's going to be some in the next day or so. They're going to be flipping the switches to try to see if they can get some more power. But the issue is right now, when you have to start talking about the hierarchy of needs, wearing a mask is just not important to you right now because it's hot. You are bothered. You have medical issues that you kind of can't really address, which are exacerbated by the heat. People are trying to drain and drain all of their refrigerators out so that they don't have just this horrible stenches in their house. And the thing that's really bad, though, is that it's an evil trifecta. People still have PTSD from Hurricane Katrina, and then they have COVID. That's another issue. Now you got Ida. So people are really at their wits' end. And what's happening is that people are wanting to escape. How do you escape? You drink, you smoke, right? So if you drink, then that makes you more dehydrated. You don't have any water, so now all of your medical issues are going to be exacerbated, but you're trying to escape from the reality that you may not have power for a month, and it's 90 degrees. I mean, it's a real serious situation down here, Joe.
How bad is the healthcare infrastructure in New Orleans? How are they dealing, the hospitals?
Well, one thing we did learn from Hurricane Katrina is that we needed to make sure that our hospitals were solid. And right now, the hospital service has been uninterrupted. We had to make sure that the generators and all these types of things were, 20 feet in the air so that they wouldn't get storm surge, all these types of things. So unless you had major structural damage to your hospital, the patients have been fine. The problem is, I don't know, a lot of people haven't been through a hurricane, but after a hurricane, people, like to get out in the street and cut down the branches with chainsaws, and then they hurt themselves with the chainsaws because they've never really used them before. Then they break their arms because they're up on ladders trying to change lights, and so it's a lot of trauma that we have after. So those people kind of can't really fit in the ER, and they really kind of can't fit in the hospitals because the hospitals are full of COVID patients, most of them unvaccinated, which makes a lot of doctors very, ambivalent about the fact that I got people that really need to come in here, and then I have people that chose not to get vaccinated, and they're taking up my beds. And a lot of doctors are feeling that around the country.
Some of the hospitals in Louisiana had to fly the patients out of the hurricane zone, but there's no room in the ICU in Texas and Mississippi and Alabama. So what happens?
We have to fly them further out, and that's where private industry comes into play, and transport. I mean, we literally had a person trying to get out, and we had to go all the way to Utah to get a bed for the ICU because after this is one thing that's really interesting about hurricanes. I want people to understand: the hurricane comes through, and when the hurricane is done, it's done. I mean, if I flip my camera around, you'll see it's the most beautiful day in New Orleans. It's just hot, but you can't, the infrastructure, you kind of don't have, flights coming in and out of here that, that are commercial. So you have to have the transport systems. And I will tell you, the mayor of New Orleans is doing a very good job keeping all of the generators going by getting the fuel in from around the country by tankers. But what we also have to do is remember that we got to get these patients out of here, and we've got to just try to make people understand that this is something that can always happen, and it can happen to you. And that's the difference between sympathy and empathy, because people in New York, I'll never forget this. When I went up to New York to do a lecture after Hurricane Katrina, they were like, that why do you live down there? Why that's silly, blah, blah, blah. And about a couple of years later, I was up there after Hurricane Sandy, and that was the difference between sympathy and empathy. So I want people to really just kind of take that in mind when they see these graphic images.
Got to leave it there. ENC's Chief Medical Editor, Dr. Corey Hebert. As always, thanks for being with us, and stay safe.